I'm often asked, how long does it take to do this operation and what's the recovery time? So they're similar, but there are some differences between a standard laparoscopic Nissen fundoplication and the links. With the Nissen fundoplication, it's the type of surgery where you come in on the day of surgery and go home the next day. We want to make sure that swallowing is normal. You're going to be on a liquid or mostly liquid diet initially, and then we get you on normal foods over about 6 to 8 weeks. With the LINX procedure, this can be done as an outpatient surgery. So you come in on the day of surgery and then you leave the same day and you're eating normally immediately afterwards. And that is, again, to rehab the LINX. We need to have it opening and closing during the healing process so that the scar tissue that naturally forms is going to allow for full extension and opening of the device. And I don't want to be in any way disingenuous. There can be problems with swallowing, even with the LINX during the healing period, and almost always we can get patients through that with very little difficulty. And by, again, the 6 to 12 week mark, we're having patients have just normal eating experiences, both for the LINX as well as for the Nissen. Patients usually are able to go back to work within about 5 to 7 days with both procedures. In my experience, I was back operating here at the hospital within a week of having my procedure. So the recovery is fairly quick for both of them. I think the patients with the LINX recover a little bit faster, but by 2 to 3 weeks, both patients look just about the same. There are lots of common questions I have to field about the LINX procedure and long-term effects. So we'll hit those in quick succession. Number one, does insurance cover my LINX? Well, the answer is yes and no. So it's a little bit complicated. Medicare absolutely covers the LINX procedure. There are certain insurances out there that cover it, but I would say by and large at this stage in time, in early 2015, most insurance companies don't cover it outright. So we have to work with you, the patient, as well as your insurance company to really get them to see the value in the LINX. And we work with a outside consulting group, and we can almost always get these approved over a period of time. There are some times when they absolutely won't be approved, and then we look at some of the other operations. Can I have an MRI with my LINX? And the short answer to that question is yes. MRIs come in 3 varieties: low power, which is 0.7 Tesla, often seen as an open MRI; a medium power, which is a 1.5 Tesla, and then a high-powered MRI, a 3 Tesla MRI. And the concern is, like, people often wonder, are these beads going to go flying out of me or something like that? The answer to that question is always no. What ends up happening is if you have a high-powered MRI, it will demagnetize the magnets and they just won't be effective. So they're not going to go flying out, there's not going to be any damage. Currently, and up to this point in 2015, we have approved the 0.7 Tesla MRI, and that's good for any LINX out there. The company just recently made a few changes to the device, and it's now approved for a 1.5 Tesla MRI. So moving forward, we'll be able to have patients have access to 1.5 Tesla as well as 0.7 Tesla MRIs. And just as an anecdote, we've had patients get MRIs. Sometimes they can affect the LINX and sometimes they don't. And also it's important to remember that there are lots of reasons why you might not be able to get an MRI. The medical community has lots of diagnostic tests at their disposal that would allow you to get diagnosed for any given disease not utilizing an MRI. MRIs are nice, certainly, but they're not absolutely necessary all the time. Finally, can I go through the airport with my magnetic beaded bracelet? And again, as someone who has one in them, I've never had a problem. Even if you did, you can you can show them your implant card. Everybody gets an implant card. You say, I've got an implant, it's right here. It's a magnetic beaded bracelet. But as a guy who travels around the country giving talks and teaching a lot, I've never had a problem, and they've never seen it, both with the normal kind of walkthrough thing and the fun little x-ray that you get to. So none of those have been a problem. Another question on the procedure itself. Well, again, you come in on the day of surgery and you get to go home the same day. We have you eating a normal diet. right away. The procedure itself takes me about 30 to 40 minutes, depending on if there is a hiatal hernia or not and what we have to do to fix it. But on average, about a half an hour, a little over a half an hour. Of course, there's time going to sleep and waking up, but from a surgical standpoint, it's about a 30 to 45-minute procedure in most surgeons' hands. Recovery time, you'll know that you'll had surgery for 2 or 3 days, and we'll give you pain medication and things like that. But really, folks recover very quickly. I think I mentioned earlier that my personal experience undergoing the LINX procedure was that I was back operating within less than a week. One of the questions I get asked a lot, and also I see out there on social media and Facebook sites, is I think my LINX may have moved. And to date, there have been zero out of 3,000 LINX placed, 0 migrations. So is it likely to move? The answer is no. Could it possibly move? I suppose the answer is yes. How would we diagnose that? Well, you could diagnose it with something as simple as a chest x-ray and see that it's in place. An esophagram, again, is a great test to look at where the positioning of the LINX is. An endoscopy can take a look and see where the constriction is. But part of the procedure itself is to place this device between the vagus nerve, the posterior vagus nerve, right at a certain spot on your lower esophageal sphincter. And that vagus nerve initially holds it in place. Then the scar tissue that your body naturally forms around this is going to hold in place. In fact, the little titanium rods that connect them could probably all be made of an absorbable material, because once that capsule's in place, these beads are not going to go anywhere. They're magnetically attracted to each other. They'll open and then they'll come right back again. So they're probably not going anywhere.